supposed to stay on topic and not ramble, but I had to insert some overview of, you just saw 3 people that could be in your practice. Kenny, I agree, is an extreme case, but both Missy and Daniel are everywhere. And so when I had my general practice, at first I just started doing OSB in quiet times away from the hustle and bustle, and certain days. And as it got bigger, and because of losing my daughter and almost another one and having trouble with myself and my son, it became obvious that this is really important for me to be able to do it well and help other people with the same problem. And as I discovered, the whole practice was full of these people. But the problem was I was trying to manage both the full-time general practice and the growing OSB practice. Because of my passion and stage and age, I had never worked with an associate, so I went on and sold the practice. And for anyone thinking about doing this, I would suggest getting an associate and letting them keep the practice going. You grow the OSB part, you can have a couple associates, and you have relationships with all those patients, and you know their health histories, and they're coming in regularly, so that you may plant the seeds on one hygiene visit and on another hygiene visit be able to suggest to them that this is the time they've gone from a little bit of medication to a lot of medication. And if they're not sleeping well and they're having all this pain and suffering, then it's a good possibility the appliance would be able to help them and make a diagnostic appliance for them. Let them hold the puppy, so to speak. This is how and why we should balance oral function. The truth of the matter is, we're doing it all the time without any realization that we're doing it, and therefore we're not optimizing the functional aspects of our dentistry in relationship to the hard and soft structures like the tongue. If we pay attention to the tongue, and we actually have concrete ways of doing that now, you'll see all kinds of other problems, not only sleep, not only TMJ, but a plethora of other symptoms going away. And I tell people I don't treat any of those things. This is just what happens when you get oral function balance. And he'll have to forgive me for your chronic fatigue of 10 years going away, or your numbness in your feet going away. This is all autonomic stuff. So if you balance things out in the oral function area, you're going to see these kinds of changes. And it doesn't take long. You can do this. If I can do it, you can do it. So the good reason for looking at oral function is we affect it whether we know it or not. Let's optimize it, and it becomes a whole another profit center within an already established practice. It's not like you have to go out and hunt patients up. You're helping your own people and your staff. I mean, the staff get really excited about this. I had a hygienist actually was able to not only see the need for it, but discuss it with the patients and encourage them to come in for our consult. And when they turned into a regular patient, on the times that she wasn't booked, she would see the patients we had continuing care for these appliances so that they don't get too far away without them being checked. So there's all kinds of good reasons to do this, not to mention the fact that you don't have to go out and take on a whole nother specialty for doing light appliances. Now let's just consider the tongue and change the oral. So we're going to move from why balance oral function or to the how. But scattered throughout this, every person you see, I hope it will be why. Why is this person going around suffering this? And you're the dentist. This is the time. It's your time to step up and have dentistry do another paradigm shift for helping people. I mean, we've always been in that business, cosmetics and chewing, but function is now related directly to many of the things your patients are taking a multitude of medications for and going to see countless doctors and medical people for. And you work with all of them, but you become the person that's helping them get rid of the core problem, and then all of a sudden you're their hero. And I know you don't do it for that, you just don't do it for the money, but this is a reason to do it for the patient and also experience these other things that make going to work I crawl in here to do this. That's good. Beep, beep, beep. So one of the other side effects is that the staff are actually, because it's working out of the mouth and then coming back to you for advice, many times they are seeing these changes that they're a big part of. The model of the doctor overseeing the changes that take place in the lab, and then when the patient puts it in their mouth and experiencing these things, allows you to actually oversee 2 or 3 different parts of this picture. But the staff become intimately involved with the patients and are very important. It becomes very smart practice management. But also it's so much more hands-on for them. They just don't have to sit back and feel just like an observer. They are actually a doer and a producer in their own way, in their own right. They're a part of this life transformation, and it happens every day. So what nicer way to have a staff that realizes that they're just so important to those patients, and they rise to the occasion. Many of them do, because it is stimulating and very satisfying. The other thing that we are doing is now moving into how we do it. So we're going to walk through just a person coming into the practice, and we will talk about the how more, how we do it. But the first contact is so important, and we're going to then, as we move past that, also be showing you why we do it. But you'll also have this connection with the patient that you have with a few of your patients, I'm sure, but on the patients that we're seeing, it's imperative to connect with them heart to heart. They have to know that you're open and transparent with them to the degree that you know them. And many times as you are more open and transparent, they will be more open and transparent also. And you develop this deeper relationship that just transcends the professional relationship. It goes to a friendship. Heaven forbid, but most of my patients are like family to me, and I'm proud of it. Very, very meaningful to end a career knowing that you've got these friends. They're not dollar bills or just a root canal in room 1. And these are people that we both had our lives changed because of working together. I learn a lot from them, and a lot of the things that they've shown me has helped everyone else, including myself and my family. So it's a whole step up. I'm concerned that we get into treating people as numbers going through, something to sell to. And yes, you're going to provide a service to these people, but it's a relationship, and it's an understanding of tragedy many of these people are going through because of a health crisis, but you can be a help him. So without any further ado, I'd like to bring you back to Joan and have her present the next section.